lumbar spine image analysis. So the objectives of this would be able to identify the anatomy of the L-spine, learn why flexion and extensions images are obtained, and learn why L5-S1 image is done. So here's the anatomy of the lumbar spine. You can see the transverse process, the pedicle, the spinous process, and then on the obliques you can see the pedicle and the C joints and the superior articular process. So AP lumbar spine. You center the patient to the midline of the grid. You adjust the patient's shoulders and hips to lie in the same horizontal plane. We reduce lumbar lordosis by flexing the knees. You use a 40-inch SID. The central ray is perpendicular to the IR at the level of the crest for the lumbar sacral, or if you just want the lumbar spine, is 1.5 inches above the iliac crest for lumbar only. The structure shown would be the lumbar body's intervertebral disc spaces eliminate and the spinous and transverse process. Okay, so the evaluation criteria for AP lumbar spine. You want all of the spine, and you want no artifacts, you want no rotation, you want open disc spaces. So as you see on the left, this image does meet evaluation criteria because it is not rotated, it has all of the spine on it, and they have open disc spaces. The image on the right is rotated a little bit, so it does not meet evaluation criteria. The lateral lumbar spine. We do a left lateral lumbar spine, so you turn the patient on the left side. You align the MCP of the body to the midline of the grid. You flex knees and stack feet on top of each other, and use again a 40-inch SID. And the center ray is perpendicular at the level of iliac crest for the lumbar sacral spine, or 1.5 inches above the iliac crest for lumbar only. The evaluation criteria for a lateral L spine. You want no rotation again. You want superimposed posterior margins of each vertebral body, and you want the spinous process in profile, and you want open intervertebral disc spaces. So the image on the left does meet evaluation criteria. As you see, is no rotation, and all the disc spaces are open, and it has all of the spine on it. The image on the right does not meet evaluation criteria because it only has 4 of the 5 lumbar spine. L5-S1 joint. This is also called a spot. You keep the patient in the left lateral position, and you again use a 40-inch SID. The central ray for this would be 2 inches posterior to the axis and 1.5 inches inferior to the iliac crest. If you cannot get the spine horizontal, you would angle 5 degrees caudet for males and 8 degrees caudet for females. This is done to help open the L5-S1 joint. The evaluation criteria for L5-S1 joint, the spot, you want an open intervertebral disc space. So the image on the left does meet evaluation criteria because the joint is open and clearly seen. The image on the right does not meet it because the joint is not open all the way. So AP and PA oblique lumbar spine. So for AP oblique, you have the patient turn from the supine position towards the side of interest 45 degrees to show the Z joints closest to IR. For the PA position, you have the patient turn away from the side of interest 45 degrees to show the Z joints farthest from IR. The SID is 40 inches, and the central ray is perpendicular 2 inches medial to the elevated axis and 1 to 1.5 inches above the iliac crest. So the evaluation criteria for this. For the AP, you want the Z joints closest to the IR open and uniformly visible through the vertebral bodies. For the PA, you want the Z joints farthest from the IR uniformly visible through the vertebral bodies. For both AP and PA, if the pedicle is too anterior, the patient is not rotated enough, and if it's too posterior, the patient is rotated too much. So as you see on the left, this image does meet evaluation criteria because you can see the Scotty dogs perfectly and all the open disc spaces. The image on the right does not meet it because the joints are not well visualized at all. So the flexion and extension. Again, we use a 40-inch SID, and for this one, the central ray would be perpendicular to the spinal fusion area. For flexion, you ask the patient to bend forward to flex the spine as much as possible. For extension, you ask the patient to bend backwards as much as possible. We do these studies to evaluate the integrity of spinal fusion, and they are usually performed 6 months after the procedure. So, the evaluation criteria for lumbar flexion and extension would be no rotation of the pelvis, and make sure the spinal fusion is in the center of the image. So as you see, the image on the left does meet evaluation criteria. As you can see, the spinal fusion is in the center of the image. The one on the right does not meet it because they are rotated and they are rotated. So, questions. The answers are on the last slide. If the spine cannot be positioned horizontal for a lateral spot image, what needs to be done? D. What is done to prevent lumbar lordosis? B. Have patient flex knees. What is the central ray for AP lumbar spine for just a lumbar spine? C. And here are my references. Thank you.